After a troubling probe into the organ transplant system, the Department of Health and Human Services says reforms are coming. The HHS organ transplant chief says some changes will include more education, better reading of a donor's brain activity, and the ability to halt procedures if concerns arise. NTD correspondent Jason Blair has more.
Yeah, I think it's important to understand that the awareness of these reports is in itself a good thing. It means that our oversight is working.
A probe by the HHS found that some organ transplants were being approved from patients who might not have been confirmed dead. In a study of over 350 cases in which over 100 patients either showed signs of life or there was no recorded time of death when the transplant took place. One case was told at a House Oversight and Investigations Subcommittee hearing on Tuesday.
Both hospital staff and the staff from the Organ Procurement Organization noted potential signs of consciousness and discomfort from the patient. Nevertheless, the process proceeded. The surgeon ultimately refused to operate, stating they felt the operation would be inhumane and unethical. The patient ultimately recovered and was later discharged from the hospital and is still alive today.
The HHS ordered changes to the organ transplant and procurement system, saying these reforms are essential to restoring trust, ensuring informed consent, and protecting the rights and dignity of prospective donors and their families. Dr. Lynch highlights some planned action.
And that really encompasses better education for the families, for the hospital teams, making sure that those teams and the families are able to call for a halt if they see concerning features, and making sure that that group, the OPO, is doing a good job understanding what is actually happening in the patient's brain. Are they injured? Are they dying? Are they recovering?
And then on Wednesday, HHS Secretary Robert F. Kennedy Jr. ordered the removal of mercury from flu vaccines, specifically thimerosal, which is roughly 50% mercury by weight. Kennedy says injecting any amount of mercury into children when safe, mercury-free alternatives exist defies common sense and public health responsibility. Today, we put safety first. Thimerosal was removed from many vaccines starting in 1999. Kennedy says he hopes other countries can follow the U.S. by also removing thimerosal. Reporting in Washington, D.C., Jason Blair, NTD News.